Now, we're live right now, Reverend Hawkins?
Well, yes, but the stream will start in just a minute.
Okay. So, you know what, Reverend Hawkins? Do you want to, since you're doing the live streaming yourself, do you, I better keep it to the script then. I better keep it to the script. I want to say, do you want, we'll have you open up in prayer. I'll open, welcome, and then turn it over to you for prayer and just, everything, okay?
That works.
And Pastor Hawkins, if you could give us just some idea of the participant numbers once Facebook and everything goes live. Like, do you see the number? Huh?
Will do.
That'd be awesome. Just to give us in case, Doris, you need it for Grant or whatever. Yeah.
Actually, he needs it, and we all need it. I'm sitting on a stool so I could try to get a different view. Let's see if I can make this work.
In just a minute.
Okay.
I believe we are up and rolling.
Let me know when you're ready.
You can go ahead.
We need Mr. Duncan, right?
Yes, we're waiting on him, but he'll come on and we can get started. We'll do a reverse if necessary. Good evening, everyone. Welcome to the Antioch Baptist Church Town Hall meeting this evening. We're going to be talking about COVID-19, the myths and the facts, and how we are going to be saving lives. And we want to thank Antioch and Charles Drew Health Center for partnering in this endeavor. My name is Doris Lassiter. I'll be serving as your moderator this evening for tonight's town hall. But before we get started, let's do what we always do at our church. Let's open up in prayer. Reverend Hawkins, would you do that for us, please?
I'd be happy to. Let us pray. Father in heaven, thank you just for the privilege of seeing another day, making it through the work week on a busy Monday, just for the opportunity that we have to gather together to discuss this important topic.
Yes.
Lord, we pray that you would be with us. Thank you for the partnerships and the people that have collaborated together to make this happen. And we pray that as a result of our gathering, that people would be informed to make choices based off of truth and based off of facts. And ultimately, our desire is for the health and welfare of our community. So we pray you would be with us in Jesus' name. Amen.
Amen.
Before I turn it back over to you, Sister Lassiter, I just want to greet those that are joining in on Facebook. So for those of you who are on Facebook, I see you. Good evening to each and every one of you. Sister Alma, Brian, Minister Sewell, want to ask you all, for the rest of you to, as we normally would do, just introduce yourself on the chat so that we know who's with us, and then that we can make sure that we greet you on this evening. And so if you would do that, we also have opportunity for you to invite someone else. And so right now we're live on Zoom, we're live on Facebook, we're live on YouTube, and we're live on the Antioch Boxcast. So there will be a replay tomorrow, I believe at noon on the Antioch Facebook page. And you can also catch it on the Antioch YouTube channel at any time that you would like. And so we're going to turn it back over in the hands of Sister Lassiter.
We are live. We are live everywhere, it seems. And we thank you again for joining us tonight. I want to tell you a little bit about, for those of you who are not familiar with Charles Drew, who are partners who's helping to sponsor our work. Charles Drew is dedicated to providing quality, comprehensive health care in a manner that acknowledges the dignity of the individual, the strength of the family, and the supportive network of the community. That's what Charles Drew is about. And Charles Drew's health, and I must say, the whole purpose of that partnership with Antioch and with all the other churches, they'd like to see more people have medical homes. And I just needed to share just a little bit about that. We have a lot of individuals who have emergency care providers, but they don't have a regular doctor to go to. Charles Drew would like to encourage you to come there to their facilities. And if you haven't looked in a while, Benson, they're growing. They're having adolescent health centers, programs just for men, as well as women, of course. But they are really dedicated to the family. They are going to continue to provide needed healthcare services to families and to our adolescents, to our youth. And they've been doing this since 1983. But over the years, the number of insured and uninsured patients they serve has steadily grown, as has their healthcare services, because it's been necessary given the COVID situations and all the other issues that we've had to face in our community. And thank God we have someone who know us, who knows about our families, knows about our churches, who be involved with our organizations. So if you would like to identify a medical home, if you want to know if you're eligible or not, it's based upon a sliding fee scale, please contact Charles Drew Community Health Center. The number is 402-451-3553. Now, Reverend Hawkins mentioned about the chat. So we want to hear from you. Not only are we sharing information, we want to hear what you've heard out in the community about COVID and why people are hesitant. So one of the things we're going to do is ask you again to put your information in chat. And if there are questions while the speakers or presenters are talking, we'll be able to get to those. Again, let me acknowledge Reverend Hawkins again. Reverend Hawkins decided he wanted to be a faith-based health ambassador for Antioch Baptist Church. We've trained over 50 health ambassadors, and now we've got him. And he represents a whole lot of churches. As you know, he's president of New Era. So we look forward to a little bit more from Reverend Hawkins. And it's nice to have another African-American male as a faith-based health ambassador. So we thank you, Reverend Hawkins. And it's important now to talk about our other presenters. We have Larry Duncan, who's not quite on yet, but we do have Dr. Kate Note from Creighton University. Kate, would you introduce yourself, please, to our community?
I'd be happy to. Hi, everyone. My name is Dr. Kate Nolt, as Doris mentioned, and I am on the faculty at Creighton University's Master's in Public Health program. I do work in the North Omaha communities as part of the Center for Promoting Health and Health Equity. And I've done some global health work. It is my honor and pleasure to be sharing this space with all of you tonight. And I look forward to your questions and some conversation. Thanks for having me.
Thank you, Kate. Thank you very much. Kate has been very modest. She's been involved with, at least I know, about 12 to 15, maybe 20 town halls by now with us. So she's very familiar.
Give or take a few.
She's very familiar with our work and what we're trying to accomplish in our community long term. And so tonight I want to share my screen, and so we can get a glance at what we're going to be talking about tonight. So I assume everyone has a Zoom ID passcode. Please share that with other friends and family if they want to come on. Reverend Hawkins, do you have the ability to have you put the Zoom ID and passcode on the screen for them to see through live streaming, or shall I leave this up for just a little bit?
If you give me just a second, I'll type it into the chat.
I'm very excited about the Zoom possibilities that we have now, we've not been able to get together physically in the church, to have these town halls. The purpose of the town hall is so that we can hear from the community and so that we can share back and forth about the myths and the facts concerning the COVID-19 and other issues that we're going to be talking about as well. All that's related to it, access to care, where can we get COVID-19 vaccine? But most important thing, we are trying to address the issues of vaccine hesitancy. And so many changes have happened. Every day there's a change in terms of who's eligible, who can get the booster now, what vaccine is available to folks. And so we want to keep you informed. And Reverend Hawkins is going to keep you informed of those things now at Antioch. He's going to also talk to you about the church and trying to keep it safe when once opened. There are a lot of things that we go through now. You all know me from Mount Moriah and what we've had to do in terms of making sure that our church is safe for our members. And so Reverend Hawkins will have written policy concerning the COVID-19 vaccine as we will work together, as we have with the other churches, in developing written COVID-19 safe policies. So let's go on with are you ready, Reverend Hawkins, when we move ahead?
We are ready. The information for the Zoom is in the chat. And I noticed that there are several members who are sharing their Facebook Live on their own personal pages. Looks like about 5 of them or so. Yeah, looks like 5 of them right now. So the live stream is being put out on multiple different Facebook pages,
Very
as
good.
well as some that are on the chat.
Very good. Now, tonight's objectives, we're going to, as I said earlier, we're going to explain actually the science and the safety of the COVID-19 vaccines. You need to really know the facts, the real facts. Understand why race is a factor with the COVID-19. And then the new COVID-19 vaccine guidelines, myths and facts. What's the hesitancy? Reverend Hawkins is going to go over that with each of you. And then we want to have questions and from our community, from our congregation. Looks like there's something. Okay, so we have the opportunity now to get started with why is the vaccine important? If you know me, you know about the importance of collecting data and why we own that. That's our data. We need to be able to share and figure out what we need to do about our own lives as a result of what we know to be true. The information that we've collected thus far, as of November 15, 2021, I wanted to know how many actual COVID cases have there been in the United States. 46,993,724 reported cases. And from those cases, 760,266 people have died in the US. The source of this has come from the CDC. In Nebraska, as of today, and this comes from the Department of Health and Human Services, 2,561 deaths from COVID-19 in Nebraska. Well, let's just bring it on down to Omaha, to Douglas County. We have lost 846 people from Omaha. 846 souls have passed away. So I wanted to share with you just briefly, and you can get this information. This is called the Douglas County, Nebraska COVID-19 Dashboard. It will provide a summary of what's going on, the vaccinations, the breakthroughs, the risk indicators, the number of cases, tests, deaths, hospitalizations, and onset dates, and much, much more. But I wanted to gleam in on our community and the population in Omaha, particularly by race. We know that according to Douglas County Health Department, there are 334,790 people have been fully vaccinated. The population fully vaccinated out of Douglas County residents 12 and over, 70.8%. Population fully vaccinated out of all Douglas County residents, 58.6%, right? But if we look at our numbers by race, we are not where we need to be as far as African American populations, Black populations are concerned. That's another thing, because we say African Americans, but we have to say Black because apparently Douglas County does not separate the Sudanese and others from any other population, so we say Black. The white vaccine rate for those who have been fully vaccinated by race and ethnicity, whites at 55.1%, Blacks only 37.7%, Native Americans 46.6%, Asian 55.9%, and Hispanic population is there at 51.5%. We are at 37.7%. What are we going to do about that? And that's why we have faith-based community health ambassadors. That's our role. That's who we're concentrating. That's our designated market. What can we do to reach into our congregation and share this message and share it via email, Facebook, live stream, however way we can to get the message out about the importance of vaccines. Right now, I spoke with Dr. Hughes. Lindsay Hughes is the new health director for Douglas County Health Department. She's been there for maybe 2 months. And our data, I asked her, I said, well, where are we with our transmission risk compared to others? And we are high, not low, not moderate, not substantial, high transmission rates. So that's why it's important to get the churches involved. Walk-ins are now welcome in most clinics. You don't have to have an appointment. Anyone 5 years of age or older is eligible to be vaccinated. However, we know that minors 5 through 18 must be accompanied by an adult or guardian to be vaccinated. And, you know, the goal is 100% of people fully vaccinated, right? But right now, as of November 12th, Douglas County has that little needle that we have. We see this with raise funds. But anyway, it's 58.4%. And so we want to get that number up. We have to get our 37% up than what it is. So when we look at the total cases in the United States, there have been 46,626,034 cases. Deaths, 755,000. That's in the United States. Douglas County now went up to over 90,000 cases, 90,000 cases, and deaths, 846. Last week, it was a little over 800. You understand how the numbers are going, why we are at risk, the high risk factor that we have? Our transmission is high, and you can see as a result.
Mr. Ambassador.
Yes.
Quick question before you proceed. We've got a healthy chunk, if not the majority of our members that are in Sarpy County. Mm-hmm. Can you provide for us, or maybe Dr. Nolt, maybe you can do that while she's presenting the Sarpy County website. If you can put that in the chat, I can grab it from there and put it in the chat on the Facebook chat as well.
You want the Sarpy County for the COVID-19 numbers, vaccine numbers?
Correct.
Yes.
Okay. See what I can get you.
I don't know if they have it broken down by race, maybe, but you can take a look at it. Nationwide, Black people have died at 1.4 times the rate of white people. And the communities most impacted by this are communities of color, the elderly, essential workers, and those living in multi-generational homes. And so it is very important that we, when we take a look at the critical need of this population, of our population, what should we be doing? And why aren't people getting vaccinated? What can we do to help get them to get the vaccine? Is it transportation? What are the barriers? So that's going to be Reverend Hawkins' job, is find out within your congregation, what can we do to get 100% of Antioch members vaccinated? and he's doing his fair share. He's already started a process already. Why does racial and ethnic minority status play a role? Well, minority communities are more likely to work in jobs that cannot be done remotely. They reside in households with multiple generations, suffer from chronic diseases such as diabetes and high blood pressure, cardiovascular disease, and may be impacted by bias and systemic racism in the healthcare system. It was this way before COVID. So let's just be clear about that as we began these discussions. But now let's see what we can do to address the issue now. I am going to, normally this would be Mr. Larry Duncan, who will talk about the mental ramifications and recommendations regarding COVID-19 and Black Americans. We're gonna go ahead and go straight to Kate. If you're ready, Kate, I'm gonna stop share for just a minute. Well, we'll just go on to your, how the vaccines work. And then when Larry comes on, then we'll get back to him on the history. Is that all right with you?
Absolutely. So just a note, Pastor Hawkins, I did drop a link to SARPCast in your chat on the Zoom, which if you can copy and paste that into the chat for the Facebook attendees, that might be helpful. You got it?
Yes,
okay,
ma'am.
now that's not directly to the data, but there is a link to the data on that. And I can do more digging after this section. So again, good evening, everyone. I'm Dr. Kate Nolt, and I'm going to share with you some information about how vaccines are actually developed. I know there's been some concern about the process for the development of these vaccines and how quickly it all went. Next slide, please. So, but if we could just back up for a moment and just talk for a little bit about just vaccines in general and what their purpose is. A vaccine is meant to teach your immune system how to identify a particular disease, whatever the vaccine is targeted for. And so that your immune system, if you encounter the disease in real time, your immune system sort of says, wait a second, I recognize this. And it sort of musters this army called antibodies to fight the actual disease from developing either at all, so preventing it, or maybe you get milder symptoms. In the case of COVID-19 vaccines, they teach our immune system how to recognize and fight the actual COVID-19 virus that causes the severe symptoms of COVID-19. So the goal is to get everyone vaccinated so that, because this is a highly communicable disease. And so we want to be able to reduce the amount of people who get the signs and symptoms of the disease. Next slide, please. Thank you. So this is a graphic of how vaccines are actually produced on an accelerated timeline. Normally, vaccines are developed in clinical trial, preclinical trials, and clinical trials, which are very, very costly and very long. It takes 5 to 10 years under different circumstances to actually develop a vaccine. However, we were in, if you can think back, way back to when the pandemic first started, thousands of people every day were dying. There wasn't much going on except death. And it was slow and lonely and hard. And we needed to, because of the emergency, the emergent nature of the disease and the numbers of deaths, we needed an accelerated timeline in order to develop a vaccine that would help reduce the number of deaths. It will not prevent disease, but it prevents severe disease, because we know that this can cause someone to be on a ventilator and to have a slow and lonely death. And so the purpose of the vaccine is to prevent that from happening, not necessarily prevent getting disease. We have other things that we can do to help prevent getting disease. But for what's in front of us, the preclinical trial phase is where everything is done in a lab. Maybe some animals are involved, not humans. And safety monitoring and effectiveness monitoring starts from minute one that a preclinical trial starts. If any of the animals or the testing scenarios fail nothing will leave the clinical trial phase. It will never make it to human beings. So effectiveness and monitoring for safety starts in the preclinical trial phases. Once everything passes in preclinical trial, it goes to phase 1, where there's a small group of humans who begin to volunteer to get the vaccine. And again, safety monitoring is still ongoing. Effectiveness monitoring is ongoing. And between phase 1 and phase 2, if everything looks good in phase 1, we start phase 2 by branching out to how many different populations we can recruit in order to continue safety monitoring and effectiveness monitoring. And we're talking about people from all backgrounds, very diverse. We have ethnicities, origins, different backgrounds, people with medical conditions, healthy people, different combinations of medical conditions. All of these are all part of the thousands of people that are part of phase 2. And as safety and effectiveness monitoring continues, it moves into yet another phase. Now, all of these phases were shortened, but no steps were skipped in order to make the COVID-19 vaccines. Again, no steps. The same steps that have to happen in 5 to 10 years happened in the accelerated timeline. Why was this able to happen? Because the governments understood that we needed something quickly. So they threw millions of dollars, which they would not normally do, behind the development of this vaccine, because they realized we needed to start manufacturing and approving vaccines and get them out to the public. So that's how the timeline worked with the COVID vaccine. Next slide, please.
And those millions of dollars are part of the money that we also contributed as well.
Correct. So some people have concerns about the technology behind the development of the vaccine. And as it turns out, the mRNA technology for this vaccine is actually about 30 years old. The technology has advanced over the last 30 years, thanks to the work of Dr. Karko and Dr. Wiseman, University of Pennsylvania, immunologists who worked together over 30 years to advance the technology of mRNA. It is not new technology. It was used in these vaccines. It's safe. It does not bother or interfere with DNA. DNA is housed inside your cell. This does not go inside that, and nor do these vaccines use live virus, which we'll talk about in a bit. Next slide, please. So there's currently 3 COVID-19 vaccines, and I know there are some other pharmaceutical companies that are working on having theirs released. The Pfizer, Moderna, and Johnson & Johnson are the ones you hear about the most. Pfizer and Moderna are about 95% effective. Johnson & Johnson hovers around 85% effective in preventing severe disease. And this is what we want. We don't want people dying. We don't want people on ventilators. We want people to be, if they do get symptoms, to be able to manage those symptoms at home and prevent the spread of the disease to family members and friends. That's the goal with these vaccines. Next slide, please.
Dr. Nolt?
Yes.
Can I ask a question here?
Absolutely. Please.
With regard to the vaccine preventing serious illness and death and ventilation, can you speak to this? Was one of the things that came up in our training, and I'm sure there may be some tonight that may have the same question. Does the vaccine prevent you from spreading the virus?
It does not. So that's a great question. So you can have the virus and not know it because you don't experience the symptoms. And so if you are out without a mask within 6 feet and talking to someone who is also not wearing a mask, and there's aspiration going between, that's, kind of microscopic spit, if you will, and it contains some virus in it, you could be spreading it. If you sneeze, that's even more virus in your sneeze. So you may not know it. The science on how spreading the disease occurs, when it occurs and under what conditions is still developing. Remember, this is all only a year old. So it does not prevent the spreading of the disease but you have to have it in order to spread it. The problem that we have, the challenge is that we don't know when we have it if we are what's called asymptomatic without symptoms.
So my follow-up question would be, does the vaccine prevent you from catching the COVID-19?
The science on that is still being developed. There's no science right now that I've seen anyway, I'll qualify that says that the vaccines prevent disease from getting the disease. So because we can't say that it prevents the disease, it can only prevent severe symptoms once you contract the disease, then we can't say that it's 100% guaranteed. Nothing is 100% guaranteed, right? So this is really about managing your risk. So if you have a medical condition that puts you at risk, even for the flu, let's say. Now, COVID-19 is not the same as the flu, but let's use the flu as an example. If you have to take certain precautions to avoid getting the flu because you have a pre-existing medical condition, the same, if not more, precautions are needed to avoid COVID-19, because with that pre-existing condition and COVID-19 on top of it, you run the risk of having severe disease, even with the vaccine. The vaccine, though, is meant to reduce the number of hospitalizations and death related to COVID-19 directly.
Thank you for the
You're welcome.
clarification.
Sure. So there are different types of viruses, and the attenuated virus means live virus, but a very, very weakened version of the virus. That's what you get in the flu shot. That is not what we have in the COVID-19 virus vaccines. The mRNA vaccines are not live virus. Johnson & Johnson doesn't use live virus either. They use a kind of synthetic version of the virus in their vaccine, and they don't contain any of the same, what we call antigens, as the COVID-19, but the body still recognizes it to produce those antibodies and things if you encounter the actual disease in real time. Next slide, please. So the COVID-19 vaccine originally, if you recall under that clinical trial graphic, was approved through the FDA, the Food and Drug Administration, and they originally granted what's called emergency use authorization, which means the data set that they had from all those trials was large enough to say, yes, we have enough positive gain here. Let's get these vaccines manufactured and out to the public. Now there is full authorization for Pfizer. I believe Moderna is in a close race for getting that also full authorization. And actually, Pfizer has been approved for younger ages as well, and we'll talk about that in a little bit. So Pfizer and Moderna vaccines and Johnson & Johnson. So Pfizer and Moderna are 2 doses. You need to have your first dose. You are not fully protected until 14 days after your second dose. But it's important that you get the same manufacturer for the first and second dose. And we're going to go over how that happens. And then, of course, Johnson & Johnson is a single dose only. Next slide, please.
Dr. Knope?
Yes.
There's a question on the Facebook chat. First question is, given the current rate of vaccinations, what are the chances of the virus mutating again and bypassing the vaccine?
That's a great question. So viruses survive through mutation. That's how they survive. Now, we right now have 3 or 4 variants out there. The Delta variant is the most dangerous and most highly communicable or spreadable version of the virus. I have not seen any science on what are the chances that it's going to mutate again. But what I can tell you is the more people that are vaccinated, the less the opportunity the virus has to survive. So if we're finding that there's large groups of people who are not getting vaccinated, then there is still a chance that it'll mutate and continue to spread. The COVID-19 vaccines that are out on the market now act as an umbrella. So if you see, and if you imagine an umbrella, all the variants right now are covered under the current vaccines. So as things mutate and change, the pharmaceutical companies will need to be able to, and I guess the governments will need to be able to prepare for adjusting the vaccines as needed. This is why boosters are good, because boosters can also be developed to tweak. So we haven't talked about boosters yet, but the current variants are covered under the current versions of the vaccine.
All right.
So the Pfizer and Moderna vaccines need to be given a certain number of days apart from each other. So your first dose of Pfizer is given on a particular date. When you show up at the clinic, they're going to hand you a card that has the date and the type of vaccine that you got. You need to hold on to that card, and it's been recommended that you take a picture of it on your phone, just in case if you have a phone, or you put it in a card holder, which sometimes these clinics are just giving to everyone. Then 21 days later, so you'll be scheduled with that dose 1, you'll be scheduled 21 days later for your follow-up. It's for your next dose, not your follow-up, your dose 2. You need to make sure you get that second dose in you, because you are not fully protected without that second dose. And it's even 14 days after you get that second dose that you need that time for full protection. Moderna is the same process, only it's 28 days between dose 1 and dose 2. And both doses are necessary for full protection. Again, I'll repeat, there's no live virus. It can't make you sick. That doesn't mean you won't feel a little achy, and we'll go over some side effects soon that have been recorded as happening, but it should not be administered with any other vaccine. So this is flu season, and you might be encouraged by your doctors and your clinic nurses to get your flu vaccine. And if you need shingles vaccine or any other type of vaccine, you want 14 days between those vaccines and any dose of the COVID-19 vaccines. So you want to be sure that you do not take any other vaccines within 14 days of your COVID vaccines. So you want to check with your doctor and just make sure, if you're planning on another vaccine, a different vaccine, non-COVID-19 vaccine, just schedule that appropriately with your physician and just make sure, or whatever clinic you go to, make sure that those are 14 days apart. And the FDA, as we've said a couple of times, have now cleared the Pfizer vaccine for ages 5 and up, and only Pfizer right now is approved for that. You heard me mention booster shots, the COVID-19. So they're talking about the fact that after about 9 months, 10 months, we may need boosters to keep our full protection. Right now, I think they're mostly concerned. Everybody's getting them when they can, but I think the biggest concern is with the elderly, immunocompromised people, and healthcare workers. And you should check with your doctor, look at the date that you got your first dose, your second dose, and plan on how long it's been since those doses, and ask your doctor, is it time, and recommended for you to get a booster shot. Next slide, please. All right, so choosing your COVID-19 booster shot. Oh, this is an update. So you can choose whether or not to get your booster shot. It's probably a good idea if you're compromised in any way. Or not. Some people have a preference for the vaccine type that they originally received. So if you got Pfizer with dose 1, dose 2, should you get Pfizer again for the booster? You can talk to your physician about that. Others can get a different one. They can say, I got Pfizer, but I really would like to get the Moderna one now. You can allow for this mix and matching. I think the CDC says it's okay, but talk to your physician if you have any concerns. Next slide, please. So people with underlying medical, did you want to say something, Doris?
Yeah, I just wanted to share. I know this is an update because this was new. I was getting the information. So people always ask the question, well, what do you mean underlying medical condition of what age group? And based on their individual risk and benefits, that's what the underlying medical condition, the risk of severe illness from COVID-19 can increase from adults of any age with underlying medical conditions. So it's just not for the 65. And I want to emphasize anybody 18 to 49. And this recommendation may change in the future as more data becomes available.
Yes, and this is why it's important to speak with your doctor or a doctor. If you don't have a medical home just yet, this could be a really good reason to adopt one, just so that you're getting correct information from the people who can advise you well on whether or not anything you already have, if it's diabetes, if there's metabolic syndrome, if there's any type of other medical issues that you've had, even over the years. Maybe you haven't had it recently, but you're concerned. Right. You just want to be sure that it's safe with all of your medical picture to get it. These are safe vaccines. The question is your medical picture a good fit for getting the booster? And so that's a great question for your healthcare providers to help you explore.
Dr. Note, a couple questions in the chat.
Yes.
Question number one, what if you haven't taken second dose within the 28 days and the time has expired? Should the second dose still be taken?
Yes. So that's a great question, because a lot of people, at one point in time, they said that even if you go out to like 6 weeks or, it's still okay to get it. Now, if it's been months and months, you are probably 70% protected. So you would want to you schedule your second dose and bring your card with you. That card is super important, especially since you may need it for travel or to go to places, concerts and things like that. So please put that card in a safe place and get a protector for it, but don't laminate it, because once you laminate it, if you go for more doses of something, they can't write on the card anymore. So, but just protect it. But ask the place the clinic or the place you're going for your vaccines, bring that card with you, schedule it and get it done. Yes, you need that second one for full protection. Good question.
The other thing I wanted to go ahead, Reverend Hawkins.
Second question in the chat. One person says, if I received the J&J vaccine earlier this year and want a booster, what can I do? J&J does not have a booster. Can I take Pfizer? I am immunocompromised.
Yes. So it's a wonderful question to ask your any one of the physicians you have in your circle, especially the ones that are related to why you're immunocompromised. So if you are a person with kidney failure, for example, your nephrologist, your kidney doctor would be the person you would want to ask this question. Generally, the advice is that we can mix and match whatever initial vaccine you got can be from the booster, can be from a different manufacturer. But again, you want to be sure to check in with your specialist doctor to make sure that they are up to date on what your plans are and that they support you going to get that.
Thank you.
You bet. Doris, did you have anything for this one, or are we?
Well, just to emphasize what you've just said, really, in terms of the age group, we know that the risk of severe illness from COVID will increase with age. And so, and can also increase for adults with any age with underlying medical conditions. We really want this age group, 50 to 64, to pay particular attention to getting that booster. And then there was a question about, I had questions a lot about, for people who work or live in high-risk settings, ages 64 years. Well, what do you mean at increased risk? What high-risk situation? Who are we talking about here? And so it says here the people ages 18 to 64 years at increased risk for COVID-19 exposure and transmission because of occupational or institutional settings may get a booster shot based on their individual risk and benefits. And adults who work or reside in certain settings, healthcare, schools, correctional facilities, homeless shelters, may be at increased risk of being exposed to COVID, which could be spreading where they work or reside. And that risk can vary across settings and be affected by how much COVID-19 is spreading. I just showed you earlier that we are at a high factor for transmission. And they're saying that this recommendation may change in the future as more data becomes available. But right now we look at U.S. Postal Service workers, public transit workers, grocery store workers, and they'll probably be updating this list in the future. Examples of workers who may get COVID-19 booster shots: the first responders. We talked about the healthcare workers, firefighters, police, congregate care staff, education staff, teachers, support staff, daycare workers, food and agriculture workers, manufacturing workers, and correctional workers. So having said all that, would you, Kate, discuss the side effects from the vaccines?
And I'd like to, just to dovetail what you just reviewed, I would like to reemphasize that this is about risk management. When you get in your car, we automatically put our seatbelts on because we know it's risky if we get in a car accident that we could suffer some injury, but less injury than we might if we were not wearing a seatbelt. So it's a risk to get in the car without. This is a similar thing. This is about risk management. And so the scientists and the doctors and the government and everybody trying to control the spread of the disease, of the virus, it sounds a little crazy, but as time goes by, we get more and more data, which gives us more and more information in order to be able to educate the public. And so this is part of this risk management. So you put yourself at risk, you put neighbors and friends at risk when you yourself are not vaccinated. It's not a judgment, it just is a fact that it's just about managing the risk. So let's say you get your shot, it goes into your muscle in your arm. You can pick which arm you want. And you might have a little pain, just like any other vaccine you might have gotten. You might have a little pain at the site where you had the shot. So they tell you to move your arm around a lot. It might make you a little tired and give you some headache. Now, some people experience these to different degrees than others, and it's not guaranteed that you're always going to have these. Some people don't ever get these. It is the experience of the data that we've gotten that some people never get these side effects. Some people get them mildly to moderately. They last 24 to 36 hours or 12 to 24 for some. I've heard both. My first vaccine didn't bother me at all. My second vaccine did, and because I knew what date I was going to get it, I put in for my job to be off because I expected to be, laying low. And it actually wasn't that bad. I got the chills and I was a little tired. So it gave me a good reason to stay in bed. And that's what I did. I slept, and the next day I felt fine. The side effects show that your vaccine system to build that protection I talked about earlier. And again, these could be mild to moderate side effects. You might get a slight fever. I had chills, but I didn't have a fever. And I didn't have a whole lot of muscle or joint pain because they tell you to move your arm around a lot to prevent that. And that works. Ice also helps. So different age groups have different variances of side effects. So again, these are very safe vaccines. Moderna is approved for 12 years or older, Pfizer 5 years and older, Johnson & Johnson also 12 years and older. And I know a lot of things have been talked about if you're pregnant or breastfeeding or considering to get pregnant. These vaccines have not been shown to affect fertility, to affect a fetus if you're pregnant, or to compromise breast milk if you're breastfeeding. So they're very safe. If you're concerned, ask your doctor. Pastor Hawkins, did you want to add? Or
Yes, another question in chat. You may have answered this already, but
no
this
problem.
person may have just hopped on. The question says, what causes this virus to mutate into other viruses?
That's a great question. I wish I was the type of doctor that could give you the science, and it would probably bore you anyway. But what I will say is it's time. When viruses need to survive. And so they mutate in order to survive, to feed off the next person, or, to become spreadable. So it really is about the mutation of the virus over time in order to survive. That's probably is about as succinct as I can get with that.
Kate, can you talk about when not to be vaccinated?
Sure. So contraindications are when you shouldn't get vaccinated. So if you have experienced a severe allergic reaction to vaccines in the past, maybe not COVID related, but let's say flu vaccine or something else, you may want to check with your doctor about any potential for an allergic reaction to this vaccine. Doctors that you would see for allergic reactions would be able to address any type of this. And also, I do want to mention that a lot of this information is available to everyone at cdc.gov. That's the CDC website. And they have this banner across the top of the website, and there's a button that says Learn More. When you click on Learn More, it takes you to every topic you could possibly think of regarding CDC. It's cdc.gov.
Oh, I said cdc.com. I'm sorry.
It's cdc.gov. No problem. cdc.gov. So just check with your doctors if you've had an allergic reaction before, because you wanted to make sure that there's no ingredient or anything in this that could potentially be dangerous. But the science is good. People are not having these such a tiny fraction of people. Remember, I think the numbers, correct me if I'm wrong, Doris, the most recent numbers are close to 400 million people around the world have had these vaccines, and such a teeny tiny fraction have had severe allergic reactions. So the Johnson & Johnson vaccine, you may recall back in April, had a blip in their administration because there were cases of blood clots in women that came up between the ages of 18 and 48. At that time, nearly 8 million doses had been given in the United States, and only 6, or I think when the final number was 15 cases of blood clots had developed. So at the time, or the symptoms that they reported were severe headache, backache, abdominal pain, shortness of breath, leg swelling was part of the indicator that it was blood clotting, and some bruising. This occurred within 6 to 13 days after they had gotten their vaccines. What they did was for safety reasons, they suspended the administration of Johnson & Johnson for a short time. There was an advisory committee that was developed to read into every one of the cases, and it was reviewed and once again deemed safe, considering the number of people that had gotten it and not had this reaction. And the committee voted to reinstate the vaccine, and it is now safely available to everyone.
And the reason why we continue to talk, because we want to make sure that our community understands, and that this may come up as a question to you, for Reverend Hawkins, to you who've listened to this. We want to make sure that the community will have as much information as possible, even though the things aren't popular to talk about, but we must speak truth to our community. And I wanted this information to be shared. So the variant, someone had a question about the variant. So can you discuss those?
I think there's 4 variant types now. Viruses can change or mutate after they infect a certain number of people. And this is how the viruses try to survive. So the original virus, which is called the alpha virus, has mutated, and it can change how it infects the body. Multiple mutations or variants exist in the US and around the world. These are more dangerous than the alpha virus. You don't know which one you're going to get if you encounter something. So you may hear in the news that somebody's confirmed as having had the Delta variant, which is currently the most dangerous version of the virus, because it causes more severe disease in a shorter period of time, and it's more highly communicable. These things are routinely monitored, and it's in surveillance through laboratory studies and investigations into different cases. Things are reported through the health departments, local and state. So the labs have to report when they establish that there's a case that's positive on any variant, they have to report it to the health departments. And that's how we all in what we do get our numbers that we can share with the public that we encounter. So there was a virus from the UK, a variant there, a South African one and a Brazilian one, but the Delta one is what's called a variant of concern. Most of the cases now that occur are Delta variant. What happens is we live in an age of global travel. So as people move through the different types of countries and cities, they can be carrying these variants with them, which is why these isolation and quarantine rules are important if you're traveling. Domestic travel has changed, and I think Doris has some slides later on about domestic travel that she'll review. But the Delta variant is the one we're most concerned about now because of the severity of the symptoms and disease that we can get from the Delta variant. Next slide, please. So this is just a little bit more about what I just talked about. The vaccines do seem to protect against hospitalization and death, including all of the variants that we've talked about. And this is one of the reasons why, as numbers go up, these mask mandates are very important because individuals are choosing not to wear masks, which means they're placing everyone they come in contact with at risk because you might not know whether or not you're carrying it. So while masks can be inconvenient and uncomfortable sometimes, it does protect us even if we're not vaccinated. So the upshot to all of this is protecting yourself from COVID-19 virus is an important goal, and it does continue to spread in the United States, and the variants are still circulating. And again, you don't know what variant, although most of the cases now are Delta. I do want to mention breakthrough cases. Some people have said to me, well, why should I bother getting the vaccine if I'm going to get sick anyway? Well, because if you get sick without the vaccine, then you don't have the protection from the severe disease that could lead you to be on a ventilator or death, and you could be spreading it more and more. So the vaccine does protect you and of course, by extension, the people around you from severe disease. So get a COVID-19 vaccine, wear a mask that covers your nose and mouth so that you can protect the entryway into the body, block it. The entryway into the body mostly is the mouth and the nose. That's why it's important to make sure the mask covers this whole area. Stay 6 feet apart from others who don't live with you and avoid those crowds. Of course, we heard the terrible news about the big concert that happened. I think it was in Houston, and I don't know that masks were required. In any of the pictures I saw, there were not masks. And so we may hear soon that there's going to be an outbreak from attendees there because they have to be contact traced. So poorly ventilated indoor spaces. Also, wash your hands often with soap and water and use hand sanitizer if soap and water are not available.
All right. Thank you, Dr. Note. We really appreciate the information that you've shared with us.
You're welcome.
What I want we want you to know, after you get vaccinated, we do know that the vaccine protects a person from getting vaccinated from being infected. A vaccinated person can possibly be an uninfected carrier of the virus and infect others if not taking precautions such as masking and social distancing. So we ask you to continue to stay current by visiting the cdc.gov website. There are some things that you can do now that's safer once you've been fully vaccinated. And when we say fully vaccinated, that means having at least the two shots, and then the Johnson & Johnson, and preferably now the booster. You can participate in many of the activities that you did before the pandemic. But in order to maximize protection from the Delta variant and prevent the spreading, we need to continue to wear our masks. We need to continue to do the things that we were very concerned about when this first hit. Everybody was wearing a mask, and people were wearing gloves and everything else. But if you are in an area of substantial or high transmission, and I just shared with you that Douglas County said that we are in a high transmission stage. So wearing a mask is most important if you have a weakened immune system because of your age or underlying medical conditions. They are effective for protecting you from getting sick as far as the vaccines are concerned. Based on what we know about COVID-19 vaccines, people who have been fully vaccinated can do things that they had stopped doing because of the pandemic. But we have to really look at our risk factors, measure that. I mean, Thanksgiving is coming up, and we want to, of course, we want to spend time with our family members. But let's take a look at the activities that you did prior to the pandemic. Some of the things that we did. But I think as far as going to church is concerned, let's just get down to it. I know in Mount Moriah, when we initially got the vaccines, we were able to put a policy out saying that you didn't have to wear a mask, but you did have to sit in certain seats. We have them blocked off by tape, and you can only sit in designated areas. However, because of the Delta variant, we had to ask people to start wearing their mask again and still sit in certain designated areas, okay? We also have a policy at Mount Moriah that when you come in as a visitor or as a member, we need to know if you've been vaccinated. We take the information down. We know what percentage of our members in Mount Moriah have received the vaccine.
And may I add here, please, that
Yes.
it's not a judgment of
No.
anyone if they've decided not to get vaccinated for whatever reason. It's not it's not a bad thing. This is not a fear-based conversation. If you've been vaccinated and your loved ones have been vaccinated, I say give them a big hug. Absolutely, you can do that.
Yes, but in the meantime, Kate, what we're talking about here is for the safety of our
Yes.
church. And so we just want, and the pastors really want to make sure that the congregation, that the church, its physical structure, that it's safe. And so we advise people to wear the mask and to sit in certain situations, not because we're trying to, make people afraid. We just want to make sure people are safe, and we're going to do everything that we can to make people safe. And so in doing so, we just simply ask people to continue to wear the mask, continue to practice physical distancing. We often say social distance, but we're saying physical distancing because we want people to be safe. We want a fellowship again. In our church, Kate, we love to hug and we would shake hands.
Yes, I know. Yes.
We're trying to get back to a certain situation.
Yes.
But we want everybody to be safe in doing so. You can travel now in the United States. You do not need to get tested before or after you travel or self-quarantine after travel. You do need to pay close attention, though, to any international destinations before traveling outside the United States. You don't have to get tested before leaving the United States unless your destination requires it. It used to be you had to get tested and everything. You still need to show a negative test result or documentation of recovery from COVID-19 before boarding an international flight to the United States. You should still get tested 3 to 5 days after international travel. You do not need to self-quarantine after arriving in the United States. You all know that it's required on planes and buses to wear a mask. You have to wear a mask and any other forms of public transportation, traveling into, within, or out of the United States, and while indoors, at U.S. transportation hubs, such as airports or train stations, bus stations. Travelers are not required to wear a mask in outdoor areas of a conveyance like an open deck area of a ferry or the uncovered top deck of a bus. My daughter's in England and she was talking about, she said, I have to catch the bus, but I sit at the top. I don't have to wear a mask, but I still wear one. It is, you have to be just very careful. The other thing you should still get, if you've had close contact with someone who's had COVID-19, or if you've had symptoms of COVID-19, if you've had close contact with someone who's had COVID-19, you should get tested 5 to 7 days after your exposure, even if you don't have symptoms. Even if you don't have symptoms, you should also wear a mask indoors in public for 14 days following exposure or until your test result is negative. Now, these are CDC recommendations. This is not Doris Lassiter's, but I certainly concur. If you have symptoms of COVID-19, you should get tested and stay home and away from others. If your test result is positive, isolate at home for 10 days.
We just wear a mask when
Yes.
you're around. Yeah.
So what we know, COVID-19 vaccines are safe. They are effective at preventing COVID-19, including severe illness and death. That's the underlying situation, illness and death. They're effective against severe disease and death from variants of the virus that causes COVID-19 that's currently circulating in the United States and Omaha, and that includes the Delta variant. We know there are breakthroughs, but certainly, we have more protection if we should get that Delta variant. Infections happen in only a small proportion of people who are fully vaccinated, even with the Delta variant. When these infections occur among vaccinated people, they tend to be mild. If you are fully vaccinated and become infected with the Delta variant, you can spread the virus to others.
Pastor Hawkins, do you have a question?
Yes, I just want to make sure that I'm clear. This first bullet says the vaccine is safe and effective at preventing COVID-19. I understand that it helps to lower your risk of serious illness and death, but I just want to be clear, because from a practical perspective, we're planning to, in January, first Sunday in January, to return to in-person as well as virtual worship. And my message to the congregation is that the vaccination helps mitigate your risk of serious illness and death, but it doesn't prevent you from contracting COVID-19.
Mm-hmm.
That's where the masks and the social distancing come into play.
That's correct. We have not had a cycle long enough with the vaccines to be able to have a data set that justifies actually saying, if you get the vaccine, you will not get COVID. We know that people who have gotten the vaccine have had breakthrough cases. So we know that it doesn't prevent getting COVID-19. And the science behind that is that we're getting breakthrough cases, but they are milder and they are so they're less severe and fewer hospitalizations. And you notice in some states where vaccinations are high, if you look at the numbers, there are lower numbers of deaths. The deaths are going down and hospitalization numbers are going down. So that's why.
Excuse me, I'm sorry. Let me go back to this. So the point of the matter is that what we know is based upon what we have at the time from CDC, and this is directly from CDC. So what I agree with Kate, and I agree with the question. However, we know that the Delta variant has breakthroughs. We know that when we see our numbers, that more people are dying who don't have the vaccine than those who do get the vaccine. And that's the important point here.
Other point of clarity, and this is in regard to a policy that I will set when we return to in-person as well as virtual for worship at Antioch Baptist Church, and that is, regardless of whether or not you have been vaccinated, the policy when entering the building for worship will be social distancing and masks, that whether or not a person is vaccinated has not been proven to stop the spread. And while that's an individual decision to mitigate your risk, with regard to spreading what we know is social distancing and mask wearing, because I
Correct.
want to be able to stand my ground and say I'm not going to be tracking who's vaccinated, but I am going to be requiring mask and social distancing.
And that is absolutely the safest way to be able to reopen and to have services in your building.
And,
It
and
is
let me,
absolutely the safest way.
yeah, and I think, and that's what we've done at Mount Moriah as well. We ask information so that we know what the barriers are from people not getting the vaccine. Could it be transportation? What are the issues, so we can address those issues and the needs of the people who want to get the vaccine, but perhaps can't or aren't aware, or they're still trying to understand some of the myths and the facts concerning it. As I said earlier, if a person comes in to Mount Moriah and they have not had their vaccine, we give them a mask and we tell them that they have to sit in certain designated areas, period. And that's for everybody, and so that's our purpose for collecting that information, is to understand how can we better serve our congregational members. What do they need? Sometimes when people have not received their vaccine, or if they have been around somebody or a child or their son or nephew or grandson or granddaughter or somebody, they need more information that you can share with them as well. We also need to be able to understand what their needs are beyond just the vaccine. If they've had COVID, if somebody in their family has COVID, and what they need to be doing. So it's more than just getting them into the church. It's how do we help them for any services that they may need as a result. One of the things we're still learning is how long COVID-19 vaccines can protect people. As Kate mentioned earlier, Dr. Note mentioned earlier, is it every 9 months that we're going to have to get a booster? What can we do? How do we know that? We don't know that yet. We're still learning that. I understand there are a couple of questions in chat. Okay, gotcha. Before we move on to the myths and the facts, I want to go back to some concerns. Dr. Larry Duncan, who's with Charles Drew Community Health Center, and if you all will be in prayer for him, he lost his sister. He wasn't able to be with us tonight. I think he's with his family. I knew he said that they would be planning the arrangements. He didn't know for sure, but he said that he, in those arrangements, we know how that goes, that he will probably be with his family. So he wasn't able to be here, but I did want to share a few notes about his presentation that I think is critical for, as we discuss the issues with, about why historically Americans are not equally impacted by disasters and public health crisis, and COVID-19, he says, is no exception. He talks about this from the perspective, and he uses the examples of HIV and AIDS, Ebola, Hurricane Katrina, Flint, Michigan, as we know about the lead in the water there, and COVID-19. These are examples that he often cites as the basis for mistrust. And so when we look at that, we can't say, well, you're just being foolish, you don't understand. And but we have a disproportionate situation here. There are mental health risks, PTSD, depression, anxiety, trauma exposure, systemic inequities, such and discrimination and racism. We talked a lot about this in our training with Reverend Hawkins and others, faith-based health ambassadors and community health ambassadors that were trained. A lot of information came out about the Tuskegee as to why people weren't getting vaccines, and disproportionate issues related to health issues, healthcare accessibility, the costs. Sometimes we don't have health insurance. It's just hard to get care. We don't know the knowledge of services that are available and transportation. These are access issues, not having access to care. And so he says a healthy distrust of providers because of a history of mistreatment in medical care context can also exacerbate psychological distress. People are just, I don't know what's in this vaccine. I don't know anything about it. I just based upon the past, because of Tuskegee and all those other situations that we just talked about with Katrina and the slowness of that and getting people help. However, I say to you that the past, we acknowledge that. We have to acknowledge that to people who say that this is an issue. We want to acknowledge that, but we also want to say that is the past, and we have to move forward to the future. And the vaccine, wearing the mask, and doing all the things that we've just talked about is going to ensure our safety for the future. We can't live in the past. You know, I would beg to ask any of you, if you're taking any medication, do you know the side effects from all of those medications? Do you trust the providers who make the medications that you have to take for your high blood pressure, for your diabetes, or for any other things, for your, even just for your regular headache or toothache? What's in that? Well, we take them, we pop them. We keep going because we want to be able to trust our providers. We have a doctor who we can go to. Well, how does this shift? And from national programs, program accessibility, uninsured to the underinsured, early identification and intervention, include mental health professionals in community-based settings. We have to have, he's recommending mental health professionals in church, in school, and after-school programs and so forth to help, not only just with COVID, but with stress.
I think part of this is that during COVID-19, it became clear that with isolation and quarantining, people losing their jobs or shifting employment opportunities, not having access to food or food insecurity now, with even families who didn't have it before, created a scenario where families and individuals were feeling trauma and anxiety and stress, the unknown of what was going to be happening when we would, quote, get back to normal, is causing a lot of things. So the use of telehealth, meaning being able to electronically connect with a doctor or a counselor or a psychologist, is very important, because it's how we've adapted as humans to this situation. It's a way to receive the services we need. Is it ideal? Absolutely not. But we're not in that same environment we were before. We have to adapt. Humans have been adapting to changing environments since the dawn of time. And this is how we in the 21st century have adapted to gaining access to care. The good news, a lot of people who didn't have access to care before, who couldn't get telehealth because it wasn't being offered, are now getting telehealth. People who live in rural Nebraska or rural parts of the states, and people who don't have transportation to a place to get counseling can now get it through telehealth. And I think, Doris, you're going to share what Charles Drew has available for that too, I think, right?
Right. Yeah, and speaking of that and cultural competence, it's important to have the kinds of support systems. And he talked about the importance of cultural humility and symptom expression. Sometimes it's important to be able to trust, obviously, not sometimes, all the time, to trust your provider to share the information with, right? So the things he's suggesting to incorporate are spiritual and religious modes of coping. This is what we do in our church: culturally sanctioned coping strategies, social supports, race-conscious interventions, and build on personal strengths, resiliency, and creative therapeutic practices. You know, we often talk about healthcare, but we often fail to talk about the importance of mental health when we talk about programs and healthcare. Even in our churches, we talk about chronic disease. We've had programs and services on exercise and so forth. But what about mental health? And so there are ways in which we can incorporate that very easily. We do that. We know that how we feel when we come to church, and how we celebrate, how we meditate, and but Larry Duncan is one of the most well-known therapists in Omaha as a African-American male. He understands and he can really work with us because he's with Charles Drew. So if you ever want to contact someone, we'll make sure you have that information if you need to refer someone or go there yourself. So with that, I'm going to now go back. I'm going to go to another interesting facts from Reverend Hawkins. He's going to be discussing some things with us about myths and facts that he wants you to know about. And it's not St. John Amity, he's the Antioch Health Ambassador. So Reverend Hawkins, are you ready to discuss the facts and the fiction, the facts and the myths?
Yes. Before I get started, just want to remind everyone as we are making our way to the close of the town hall, if you have any more comments, if you have any more questions, you can put them in the chat on Zoom. For those of you who are still on Facebook, you can put those chats in the comments or questions in the chat on Facebook. So some of these facts and myths were new to me. Some of these facts and myths were things that I have already entertained even prior to going through the health training. So the first one is that no racial and ethnic minorities were enrolled in the COVID clinical trials. And I can't say that I ran across that myth, but it is a myth. And at the appropriate stage, Dr. Nolt talked about that first stage where there were no humans, but at the appropriate stage of the clinical trials, there were 37%, as you can see from the Moderna, of the 30,000 that participated, and even greater 42% that participated in the Pfizer trials. So it would not be accurate to say that minorities were not included. And I think that myth is important to dispel so that we come to the understanding that the vaccine is effective for every aspect of the population. So you can go to the next one. This next myth, Dr. Notes already addressed this. I've not gotten ill yet, so I should be fine if I catch it. I'm immune already as I caught COVID and I am fine. Well, again, this is a myth. I haven't directly encountered this myth, but I sense that this myth is out there. And the reason why that's a myth is because you're still able to contract COVID-19 even if you're in good health. And I believe some of the trends as of late have to do with more younger people contracting and experiencing serious illness. And some of that would be traced back to not being vaccinated in the first place.
I'd also like to emphasize with that, if it's okay, that if you did get COVID, whether it was mild or it was more severe, the natural immunity that develops is only there for about 90 days. So you are not protected forever the same way, or 9 months, 10 months, whatever it is, as you would be with a vaccine being fully protected.
So Dr. Nolt, so when I was a kid and I ate dirt, the fact that I continued to eat dirt was a good thing.
That's right. It could have been. Depends on what state you were in.
Yeah, I just
quality of the dirt.
Just one time.
That's right.
I spaced out my and that's why I typically don't get a flu shot, because I ate dirt as a kid. So now I know that's a myth.
It's a myth.
So I have to still get a flu shot, even though I ate a spoonful of dirt as a kid. That's good to know. This next myth is one that I have encountered personally in my interactions with various people. They're not getting it because it was rushed, and what if it's not safe? And as an African American, I don't want to be the test case. I'm aware of the history. I'm aware of Tuskegee, and they're pushing this through, and I don't trust it because it's going too fast. I've encountered that. I've dealt with some of those thoughts my own self. Initially taking the wait and see. Let me just wait and see. And maybe that was around February or March or so of that mindset. And again, that's a myth. And I was glad to understand that was a myth because the government in producing this faster didn't skip steps. They just made it more of a priority, and any funding that was necessary to make that a priority was done. So, but nothing was skipped in the process. It's just as safe as it would have been if it would have taken longer. So that was an important myth to dispel. This other one I didn't hear much about the vaccine will alter your DNA, but that's not accurate. There's no live. There's nothing live. It doesn't go into your cells. The spike protein is a tad bit beyond my medical comprehension, but it's not a live virus. And so you don't get a dose of it, and it doesn't alter your DNA. The next myth, can receiving a COVID-19 vaccine cause you to be magnetic? I was surprised that this was a myth because I've never heard that to be the case. But it is not
concerned. People are concerned the ingredients have metals in them, or that there's a chip being injected where people can be followed or something like that. And so the concern was, if you remember back when thermometers, I may be aging myself here, had mercury in them, right? And so there's concern that some of the ingredients have metals to them. There are none. So you can continue with your explanation. I just really wanted to add that clarity.
But basically that's it. That it is free from metals. And so the fact of the matter is that no, you won't cause you to be magnetic. So
there was probably a greater risk of me snapping that thermometer in my mouth than taking the COVID vaccine. Next one, I'm healthy and I work out. I don't need the vaccine. This myth was particularly personal to me because I have 2 young adult children who exercise regularly. And it doesn't prevent you from contracting the virus, and it does not prevent you from the possibility of serious illness or ventilation, or even worst case scenario, a death. When I was younger, I didn't take my health as serious. And the older and more mature I get, I think I'd like to think I'm a little bit more wise in not falling for that myth. You can go to the next one. Next myth, can be near someone who received COVID-19 vaccine can affect your menstrual cycle. And the answer is no. That's not correct. Through the mouth and through the nose and your breathing or your sneezing, to my knowledge, it's not going to seep through your skin or just being next to someone. The transmission doesn't work that way, so that is a myth. is it safe for me to get the vaccine if I would like to have a baby one day? I have heard this particular concern, and the answer is yes, it is safe. There's no evidence to suggest that there will be any causes or problems with pregnancy, and I would just kind of refer to the same mindset with regard to any other type of vaccine or flu shot. I think would apply in this case as well. You can go to the next one. You get too many side effects from the vaccine. You know, this particular one is, you know, I just think about what is the greater likelihood of taking the vaccine. The greater probability overwhelmingly is that it's going to prevent you from the possibility of serious illness, hospitalization, or death. And that far outweighs the relatively few number of cases where there have been some lingering effects. The next one, do any of the COVID-19 vaccines authorized for use in the United States shed or release any of their components? The answer is no, because there's no live virus, so there's no possibility of anything from a live virus being released out of your body. And can it make me sick with COVID? The answer is no. Once again, because there's no live virus, there's no possibility of you contracting COVID-19. You may have some minor symptoms, but there's no possibility of you contracting COVID-19 as a result of the vaccine.
Okay, thank you, Reverend Hawkins. You did
By
a
the
great
way,
job.
I do want to say there's been like 7.5 billion with a B administrations of these vaccines, and they're still out there safe and effective. So that's got to say something. Around the world, 7.5 billion. Can't hear it. This is a video that speaks to the diversity of the release of development and release of the vaccine.
Can you not hear it?
We heard it, but it needed to be turned up.
Okay.
Thank you.
There's good news out there. There's a COVID-19 vaccine. Yay! Bad news is, as Black folks, it's hard to trust what's going on. So what do? Well, we turn people we can't trust. Black folks. Not just your uncle at the cookout. No. Actually, not him at all. I'm talking about like scientists.
Can't hear it very well.
Okay, first question.
Sister Lasker, if you send it to me, I can make sure I post it on all of our social media so that people can
All right, we'll do it. You couldn't hear it either, Reverend Hawkins?
and be able to share it as
Okay.
well. It was very low.
Okay, let's see if we can.
You want me to show it? I've got it.
Is that better?
I've got it. Do you want me to show it?
You can try to show it, Kate, but yours usually is kind of behind the, we'll send it to you anyway, but go ahead and try to show it.
Hello,
Are
Black
you-
America. And people
Yeah, hang on one second. Let me just share my screen.
who pay attention to what Black folks are doing. My name's W. Kamau Bell.
Can you
There's
hear it?
good news out there. There's a COVID-19 vaccine. Yay! But the bad news is, as Black folks, it's hard to trust what's going on.
Can you hear
So
it?
what do? Well, we turn to people.
I can hear it.
Black folks. but not just your uncle at the cookout. No, no, no. Actually, not him at all. I'm talking about Black scientists, Black doctors, and Black nurses. Okay, first question. The vaccine happened fast, like super fast, like Usain Bolt headed to the bathroom fast. Is that something we should be concerned about?
Having an emergency authorization for these medications was critical, but that doesn't mean any steps were cut.
Anything where money could be traded off for time, that was happening. Like money was no object.
They still have all of the rigor that they use for approving any vaccine. So we can feel confident that the science is still there. The messenger RNA technology has been in development for the last 12 years. So even though you hear this thing about warp speed, believe me, that was not warp speed.
And I think the data is real. It suggests it's highly effective.
About a week or so after your second dose, the people who had gotten the placebo or who didn't get the true vaccine, their rates of coronavirus continued to climb. Whereas the people who had gotten the vaccine, it just flattened out.
And what about side effects?
Soreness from the injection site.
I had a little bit of arm soreness.
Arm sore. Is that a side effect? My arm's sore right now.
The common things, soreness at the injection site, headache, fever, maybe a swollen lymph nodes.
The second dose is when there's more common, those systemic side effects.
Is this like one of those pharmaceutical commercials where at the end they talk real fast about the side effects and it's like, you're also going to get hair from your eyeballs and vampirism?
My sister texted me the second day after I got the first vaccine. And I remember she was like, "Are you a zombie yet?" And we just laughed like, "No, I'm not."
So the big answer is no. And the reason being is we are not injecting the virus into your body. The vaccine is training your body.
It is making those antibodies to fight that disease. So I view it as a positive thing.
So here's a question from everybody's uncle. And since I'm an uncle, it's a question for me too. Are the drug companies just trying to get rich off this?
The drug companies will certainly get rich.
Oh, drug companies are always trying to get rich, but that's not the point, right?
That is really how a lot of our innovation happens. That is why the drug companies will spend millions upon millions in research.
Were Black and brown people a part of this process, or was it only like white folks, like NASCAR white folks?
The trials were intentionally broad and inclusive.
Yeah, Black and brown folks have been recruited for the clinical trials.
We have ensured that each of the 4 historically Black medical schools, that we are all vaccine trial sites.
So here's the big question. How much are you charging us for this vaccine?
Right now, getting vaccinated is free.
Free?
Yes, it's free.
Like free.
It will be free.
Like not even free 99.
We have not charged anyone.
Okay, should I be suspicious that you aren't charging us?
No, because there are some things that the government invests in that for the good of the people.
Taxpayers like you and I contributed to development of these vaccines.
What if I'm not worried about getting COVID-19?
Like you could say, I never had smallpox. I've never had tetanus. Why do I need the shot? That's why we give vaccines. Vaccines are prevention.
I pretty much tell people you're going to be exposed some kind of way, right? So you better be ready to fight.
And what about you? Will you?
I got my first dose about 3 weeks ago.
I have not gotten the vaccine yet, but rest assured, I'm anxiously waiting.
I definitely will be getting vaccinated when my turn comes. I was scared getting it. And then after I got it, I was like, oh, well, I guess it wasn't that bad. When the vaccine went in, I felt this intense amount of honor.
Like a lot of people, I like to get my medical information from bizarre, dark corners of the internet that haven't been vetted. Is that a good idea?
Oh dear.
Please do not continue to do that.
That is definitely not a good idea.
Unfortunately, on the internet, pretty much anyone can post anything.
There are no microchips. There's no stealing of your DNA. No, none of that is happening.
Thank you, doctors. All right, I'll let you get back to work. And thank you for allowing me to ask you these questions. But before you go, just want to let you know, your parents are super proud of you. It's all they can talk about.
Thank you, Kate.
You're welcome.
Thank you for sharing that. And we're going to move on, and because we're about out of time, but there's some important announcements I know that Reverend Hawkins wants to make. And I'm going to get back to some of those announcements if I can. Let's see. Okay. Reverend Hawkins, first of all, are there any more questions in the chat? I didn't see any more. Are there any in your Facebook chat? Any questions that we need to answer?
No more questions in the Facebook chat. I believe that everyone who submitted a question got their question answered, and there were a couple of questions that I asked that were the same question that other
Okay.
people had. So I just want to announce that this Saturday, we will be hosting vaccination clinic at the Antioch Baptist Church from 3 p.m. until 5 p.m.
All right.
It would be the appropriate thing to do after we have the conversation to give people opportunity. And this is leading up to our reopening of the sanctuary in January. And so the timing of it was very calculated. So this Saturday, 3 to 5 at Antioch, it'll be the Pfizer, I believe. And so that means age 5 to 18, you can get vaccinated, but you must have a parent present. And so you can get the first dose if you need that. You can get the second dose if you need that, or you can get the booster if you're ready for the booster. That's this Saturday, 3 to 5 p.m. And then again, Saturday, December the 11th will be our second clinic. So if you have not gotten any vaccinations, you'll be able to get the first one this Saturday. Since it's Pfizer, 21 days later will be December the 11th. That'll allow you the opportunity to get the second dose. And that will also allow about 3 weeks for you to be fully vaccinated prior to the reopening of the sanctuary. And so we were very calculated to make sure that we provided information and opportunity prior to us opening doors, and also understanding that when we do, that mask and social distancing will be required, and we'll have a limited in-person seating because our social distancing capacity will be less. And so we'll send information about registration and cleaning protocols and all those other things. We'll send that out to the congregation at the beginning of December so that everyone
Reverend
can have a full
Hawkins,
of understanding.
if I may add one other thing, just in case people cannot come out to get the vaccine at your church, their Douglas County Health Department will come to your home and provide the vaccines. So if just in case someone needs it and can get out because of childcare or whatever the reason, Douglas County, all we need to do is call. They can get in contact with you and let you know, and then we can make sure that Douglas County has someone out there to give them the vaccine too.
Well, if you would send me information, because I need to find out if that's the same for Sarpy County. Our congregation is split between Douglas and
Okay.
County.
Ms. Jocelyn is saying, yes, I understand. We're going to find that out too, Ms. Jocelyn. So, okay. All righty. We'll get that information to you. I'm not sure about Sarpy, but we'll find out for you.
That's it. That's it. I want to thank everybody for joining in to our special guest. We are grateful to Dr. Nolt from Creighton. We're thankful to Sister Lassiter for being our moderator. Our prayers are with Mr. Duncan, who was unable to be present. And of course, Antioch, we had about 5 or so people that shared it on their own timeline. So it's difficult to engage about 15 people or so and another 3 on the Zoom. And so we're grateful. And once again, it'll be re-aired tomorrow at noon, but you can catch it at any point in time on our YouTube page.
All
So
right.
if that's it, let me close us out in prayer. Lord, thank you for this evening, for allowing us to gather. Thank you for the partnership with Charles Drew, and we thank you for Dr. Nolt and Sister Lassiter, and pray your grace and peace upon Mr. Duncan as he was unable to make it. That this information that was shared would guide us to make informed decisions. In Jesus' name we pray. Amen.
Amen. Amen. Good night, everyone. Have a good evening.
Good night. Thank you.
Bye, Sister Hawkins. I see you.